everybody. My name is Damaris, and I am the CEO and co-owner of Edme Nursing Tutoring, where education and mentoring collide. Today, I'm going to be going over some NCLEX test taking strategies with you by going over a question. And so I'm going to go ahead and share my screen, and let's get to it. So, as you can see here, today we're going to go over an NCLEX question, and we're going to be doing this once or a couple times a week, just so that you guys can get used to what it is like to take the NCLEX and how to apply those strategies when you're taking this exam. There are times where you'll be able to get the answer like that, and there are times where you're going to have to think critically and really apply those test taking strategies. So the question says, the nurse identifies which risk factors as contributing to the development of peripheral artery disease. Select all that apply. Our very favorite if you went to nursing school. So there's 5 answer choices for this one. Sometimes you'll get 6. And just so that you guys know, the way NCLEX does it now, they upgraded this back in 2017, where now it is possible that all answers can be the answer and one answer can be the answer. So we need to make sure that when we're going through each and every one of these questions and answers, that we are determining which answer is the best answer. All right. And so let's go into the strategies. So there are a few things you could do to apply to this question in particular. And there is one thing I'm really going to point out, which is always pick out the key words. A lot of times when people read the question, they really don't take the time to pick out key words, because those key words is what makes the question and what helps you to identify the answer choice that you need. And so what I'm going to ask you to do is to come up with some risk factors every time you're reading a question. And I also encourage you that once you read the question, read it again and read the end of the question. Okay, go and read the answer choices, try to eliminate, and then go back to the question again. Always go back to the question because you may not be realizing the key words. So in this question, there are some key words. One is risk factors, all right? So it's not asking you the symptoms and signs of peripheral artery disease. It's not asking you the pathophysiology of peripheral artery disease. It's asking you what are some risk factors, right, that cause the development of peripheral artery disease. So it's not saying that this is what is causing it. It's saying this is what is producing a development of it. All right. And then the last word is PAD, or peripheral artery disease. You got to know that that's what it's asking you. This is a disease process that they want you to know. And then you got to remember that this is a select all that apply. So be careful when you're taking your exam that you don't accidentally mix up a select all for a multiple choice and vice versa. All right. Second thing I'm going to ask you to do is to reword the question in your own words using the key words that we picked out. So here's how I would word it. What are some risk factors that develop PAD? Okay. What are some risk factors that can develop PAD? Select all that apply. All right. See, simple, right? The word that says the nurse identifies, we know that obviously in order for you to understand a risk factor, you got to identify it, right? When you're talking to your patient. So one of the ways that you're going to be able to answer this question is you have to have a basic knowledge of what the pathophysiology of PAD is. PAD is an arteriosclerotic disease of the arteries. What does that mean? What it means is that the arteries, right? The arteries, especially in your lower extremities, all right, are now clogged, thickened, and hardened due to chronic vascular disease. Okay, or chronic vascular damage. So that damage that's happening over a long period of time is causing the vessel walls to change, and it's causing it to get thicker, and it's causing it to harden, which is causing an increase in resistance, vascular resistance. You guys remember that from nursing school. And it's also causing a lack of blood flow and causes vasoconstriction. All right. Now, you also have to understand that arteries are the vessels that take blood to your organs and tissues. So it leaves the heart and travels throughout your body. Veins takes it back to your heart. So it goes back, it returns back to your heart. So now that you have that basic understanding, PAD is a lack of blood flow to your lower extremities, meaning that there is a lack of perfusion to your tissues, which causes ischemic pain. All right. So now let's apply one of the things that I always tell my students when we tutor them is to always try to eliminate your answers, but always have a rationale behind why you're eliminating those answers. So don't just eliminate it because, yeah, it doesn't sound good. Although that is what some people do, but you really want to be able to critically think, because as a nurse, these are some things you have to think of, right? These are patients' lives on your hands. And so there are two answers that we could eliminate immediately. Why? Why would we eliminate oral contraceptive use and prolonged standing? So oral contraceptives cause deep vein thrombosis, or what we also call DVT. Remember what I said about arteries earlier. Arteries are what bring blood to tissues and organs. Veins are the ones that take that blood that's already perfused your organs and tissues back to your heart. So think of it like this: arteries go down, veins go up. Okay. So if the issue is peripheral artery disease and oral contraceptives cause the issue in your veins, then that can immediately be eliminated, because your veins, the oral contraceptives is not affecting the arteries the way it does the veins because of the low perfusion in your veins. All right. And then number 5 is prolonged standing. Prolonged standing, we eliminate that because why? This is just simple thinking. This is just common sense. Gravity pulls blood down, right? So prolonged standing actually helps to facilitate the blood flow using gravity down to the lower extremities. So that can be eliminated. Now, what it does cause a problem in is when the blood is trying to go back up. So this also is one of those things that affects the veins and not so much the arteries, right? So now that we've eliminated it, now we can determine, well, what is the correct answer and why? And we always ask you to have rationales for every single option choice, because when you have a rationale, that means that not only do you have the knowledge that it takes, but you're also being proactive as a nurse, a new graduate nurse. So the correct answer for the risk factors that develop peripheral artery disease are cigarette smoking, diabetes, and hyperlipidemia. Why do these develop and contribute to the development of peripheral artery disease? Well, smoking, if you didn't know, nicotine causes vasoconstriction. That vasoconstriction does what? It reduces blood flow. And then diabetes causes your blood to get so thick that it starts to change the vessel walls, because now the blood is not moving the way it should. And this causes an inflammatory response and therefore causes damage to the arteries. And then lastly, hyperlipidemia causes an increase in plaque formation. And that further exacerbates the problem, because now even more constriction is happening to those arteries. So there you have it. The correct answers for the select all that apply is smoking, diabetes, and hyperlipidemia. And we eliminated oral contraceptives and prolonged standing because they don't really affect the arteries. They more so affect the veins. Thank you guys for participating with me today. Visit our website at edmetutoring.com. You can email us if you have any questions or concerns at edmetutoring@gmail.com. If you would like to reach out to us via phone, our phone number is 754-272-7232. I know, a lot of twos. And visit our social media platforms. Instagram is Edme Nursing Tutoring, and Facebook is the same. Thank you guys so much. Have a wonderful day. And remember, you got this.